I've been at Augusta Health for a little over a year. What I realized very quickly was that the administration here and the endoscopy staff is very well trained. And I realized that I would be able to do a lot of the advanced procedures that I was expecting to do at an academic center right here at Augusta Health. And it's really good for the population around the hospital because they don't have to go over the mountain to get that specialty training or to get those specialty procedures. They can get that right here in their backyard. As a gastroenterologist, I deal with liver disease, I deal with anything involving the stomach, so acid reflux, heartburn, H. pylori infection. We deal with irritable bowel syndrome, the gallbladder, and the pancreas as well. Irritable bowel syndrome is probably the majority of any gastroenterologist practice. We actually use low-dose antidepressants to treat people with severe IBS because of the way the brain and gut communicate. Medicines that were originally designed to focus on the brain actually work on the stomach as well. There are a lot of people who have severe abdominal pain, diarrhea, constipation, bloating, and it actually changes the way they live. But if you can get them on the right regimen, a lot of times you can cut their symptoms in half and they can have a normal life. Everybody should get a colonoscopy starting at age 50. There are some populations who should start earlier than 50. African Americans are recommended to get a colonoscopy starting at age 45. Colon cancer is one of the few cancers that we can catch early. We can actually stop it from ever occurring. The reason we do screening colonoscopies is because most polyps begin to occur as we get older. So if we can catch people at age 50 or in African Americans at age 45, if we can find those polyps while they're small, they never get a chance to actually grow into cancer. A lot of people will say, well, nobody in my family had colon cancer. Why do I need to get a colonoscopy? And I tell them, well, if you're doing everything right, there's still a 5% chance that you can get colon cancer. Why take that chance when we can keep this from ever happening? It's better to come in now, and it's better to get your colonoscopy late than to never get one. A lot of people that have had colon cancer that I've diagnosed came in at age 60, 65, and 70. I've had people as late as 75 who developed colon cancer and they never had a colonoscopy before. And whenever I see that, I'm always saddened by that because I wish this person had just come in 5 or 6 years earlier. So if you're 55, 60, 65, it's not too late.